Questions of the day. Does your child have problems in concentrating? Fail to sustain attention? Find it difficult to behave within appropriate limits or as expected? At home and in public? Or sit quietly when they are expected to do so? Not being able to stay within limits or sit quietly is normal childhood behavior if it happens at a very young age and from time to time. But if this behavior occurs frequently and interferes with your child's daily life, they may have ADHD or attention deficit hyperactivity disorder. It is normal for a very young child to run around or be more active, but if the pattern of inattention, hyperactivity or impulsivity persists beyond the age of 7 or 8 years, and if it is more frequent as well as more severe as compared with similar age group, then this may be ADHD or attention deficit hyperactivity disorder. ADHD is a neurodevelopmental condition that can affect the family life. The word neurodevelopmental refers to the nervous system, which includes the brain as it develops across the lifespan. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, lists 3 presentations of ADHD. First, predominantly inattentive; second, predominantly hyperactive impulsive, and combined. Children need to exhibit 6 or more symptoms in 2 or more settings like at home, in school or in the clinic for a diagnosis. Older teens and adults should have at least 5 of these symptoms. When symptoms of attention deficit hyperactivity disorder occur in childhood, they tend to persist in adulthood in about half of all the cases. Adults with ADHD often find it difficult to follow instructions, remember information, and concentrate on tasks or organize tasks. The behavior cannot be better explained by any other disorder. There must be clear and significant evidence of a social, academic or occupational impairment, that is, interference with functioning at home, school or work and in social settings. Without proper acknowledgement and management of these behaviors, ADHD can result in behavioral, emotional, academic, vocational and social problems that decrease the quality of life. Now, let us look at the various criteria of behavior as per the DSM-5. First, let us talk about ADHD predominantly inattentive. Remember, a person has to have minimum 5 or 6 behaviors in this group. First, fails to give close attention to details, has difficulty in sustaining attention in tasks, does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores or duties in the workplace, often has difficulty in organizing tasks and activities, often loses things necessary for tasks or activities, is often easily distracted, often forgetful in daily activities. Individuals who are predominantly inattentive are also known as having attention deficit disorder or ADD. Next, let us look at behavior of ADHD predominantly hyperactive / impulsive type. In case of hyperactivity, the person often fidgets with hands or feet or squirms in the seat, often leaves seat in the classroom or in other situations in which remaining seated is expected, often runs about or climbs excessively, often has difficulty playing or engaging in leisure activities quietly, often is on the go or as if driven by a motor. talks excessively. Impulsivity can be seen when a person often blurts out answers before questions are completed, has difficulty awaiting turns, interrupts or intrudes on others. The third group is the combined group, where individuals meet the criteria for inattention and hyperactive impulsive presentations. Here, I would like to put in a word of caution. Certain behaviors are expected at certain age, that is, depending on the age of the person. For example, a 3 to 5-year-old child can sit in a place just for a few minutes. We cannot expect them to sit for hours together. They are more active than older children. The brain does not develop at the same rate for everyone, and cognitive functions may be poor in some people and not in others. For example, a 9-year-old child may only have abilities of a younger child who is 6 or 7 years old, rather than his or her same age peers. Hence, he or she may behave like a 6 or 7-year-old and would be facing problems in day-to-day life. ADHD does not get worse as this child grows older, but the child's abilities are not developing in synchronized manner with his age. So, it may seem that the condition is getting worse. It is essential to understand the fact that ADHD does not get worse, but the tasks expected of the person become more and more complicated with age and circumstances, such as increased demand in the school and at home. Therefore, the problematic behavior like completing things on time become even more problematic, resulting in the child getting a lower grade for incomplete work or late submissions, etc. Now, let us see some classroom strategies to help the child with ADD or ADHD. While asking a question, use the child's name in the question. Use simple language for instructions and questions. Stand close to an inattentive child and touch him or her on the shoulder as you are teaching. Walk around the class as the lesson is progressing and tap the place in the child's book that is currently being read or discussed. Decrease the length of assessments or lessons. Increase the novelty of lessons by using audiovisuals like films, tapes, flashcards and small group work. It is very important to alternate mental and physical activities to give them a relief. Teach children self-monitoring strategies like giving verbal clues to self or making a checklist to monitor task completion, etc. Use a soft voice to give directions. Use peer buddy system where another capable child is assigned as a buddy for the child with ADD or ADHD to complete his work. Lastly, let us understand that ADHD is a long-term chronic condition. However, when ADHD is diagnosed early and treated properly, the condition can be managed effectively. ADHD needs to be treated through medication and psychosocial behavior therapy simultaneously. This is vital for managing ADHD symptoms. If left untreated, the person may face problems in all areas of life like family, occupation and social life in general. Let me talk about a few behavioral treatments or therapies for childhood ADHD. Behavior modification. In this approach, the child's behavior is analyzed and strategies are designed to increase appropriate behavior and decrease inappropriate behavior. Behavioral parent training. This training helps parents respond to a child's behavior in ways that will strengthen growth and development and encourage a positive parent-child relationship. Parent training often occurs at the same time as behavior modification or social skills training for the child. Social skills training, this training teaches social skills that will improve the child's ability to act positively and effectively with peers and adults in school and at home. It also provides a setting to practice the skills in a safe, accepting atmosphere. School interventions. A school psychologist or a special educator will conduct evaluation to create an individual education plan or IEP or other classroom based interventions. Organizational skills training. This training teaches older children skills to help them improve time management, organizational skills, and effectively use executive functions to increase efficiency and work completion at home and in school. Now, in case of adults with ADHD, the behavioral treatments differ a little and they include individual cognitive behavior treatment or talk therapy to enhance a person's sense of self-efficacy, relaxation training and stress management to reduce anxiety and stress, behavior coaching to teach strategies for organizing home and work activities, job coaching or mentoring to support better working relationships and improve on the job performance, family education and therapy to ensure that everyone in the family understands ADHD and its symptoms. To summarize, in this session we saw what is attention deficit hyperactivity disorder or ADHD, how caution should be taken to diagnose the condition and not loosely label someone as hyperactive, but instead seek professional help for diagnosis. We also discussed certain classroom strategies to help the child. And we saw in brief various therapies used for treating children and adults with ADHD and ADD. Remember, it is important to give medication and the therapies simultaneously for better prognosis. All the best and thank you.